thank you guys for showing up today. It's awesome to have you. I love seeing familiar faces. A lot of folks who I haven't seen in a long time come out to see this presentation, so thank you. Biggest reason why we're having this, Dr. Keith and I have known each other for a long time. In fact, we grew up in the same area, went to church together, went to different high schools, competing high schools, but we still stayed friends after all these years.
We even played intramural sports up at college together.
That's also true. We went to the same college together. So we've been together for a long time. What I really appreciate what Dr. Keith is doing is really understanding and exploring more of the regenerative services that exist in medicine, newer technology that's coming out. It's been one of the most thrilling things for me as a physical therapist, and not feeling like, hey, if physical therapy doesn't work, then it's surgery or injections. And that's just not an option for a lot of folks, especially when we see the rate of decline, but also the failure rate for a lot of surgeries that just don't take very well or do as well as we think. So what other additional options do we have that exist that can help us, at minimum, restore healing or improve healing tissue capability to rigid, stiff, and sometimes even very difficult to heal tissues like tendons, even joint surfaces like articular cartilage or arthritis, things that plague us all the time. How do we help get those areas to heal better without relying on pills, injections, or surgery to get us any kind of relief? So ultimately, that's why we wanted to do this. I'm thrilled that he's doing PRP because it's been around for some time now, but the way you do it, how you intervene with it is very different. And then the addition of shockwave and physical therapy are all things that we want to be able to package together and make a very unique offer for folks who are suffering with foot and ankle pain. So I'm thrilled to introduce Dr. Keith, my dear friend, to go ahead and take the stage and present about PRP. Thank you.
All right. Well, thanks everybody. I see some familiar faces here. So for those that don't know me, like, I'm Dr. Keith Bangart. So, just a little bit about me. Like Nick said, grew up here in the Peoria area, went to Centennial High School, and then did my undergraduate training up in at Brigham Young University up in Utah. I did medical school here at Midwestern University in Glendale, and then did my surgical training out in southern Indiana, a town called Evansville, Indiana. And then since 2011, I've been back here. And so, my surgical residency, I was it was basically a level 1 trauma center, so did a lot of major reconstruction all over the body. I focus now just on foot, ankle, and leg, as well as sports medicine, limb salvage. And so, again, learned how to fix things, put things back together, but also learned, at the same time, that the human body doesn't always play along when we want it to. And so, the reason I'm here today is, the human body is an amazing creation. We do silly things sometimes to mess up that creation, but there are ways that it can heal, and it's not always surgery and like I said, cortisone injections, pills. I mean, they all have their places, and sometimes you have to do that. But I'm going to focus today on, how we can get our bodies to heal without going through the traditional routes of surgery. And so again, we're going to discover what PRP is and the healing power that it has. Okay, so again, I'll just kind of go through some of these things, and we'll have some questions at the end, so kind of save those and we'll get going here. All right, okay, so again, I always like to start off with a little humor. I'm a foot doctor, foot, ankle, leg doctor, so we can all relate to this, right? Toes, feet are great for finding immovable objects and making sure they stay immovable. And so, that's right. It's the bed frame in the middle of the night, the coffee table, so seeing our fair share, okay? So, we experience pain from a lot of these different avenues, whether, as Nick said, there's tendonitis, there's joint pain, muscle pain, and, pulled muscles. Is that just youth leaving our body? Sometimes. My kids, I have a bunch of teenagers, and they, I'll yawn now, and sometimes my neck cramps, and like, what is going on? I'm 46, almost 47, and they like to point out that I'm old to them. But again, it's, I don't ever say old age to anybody. I call it a youth deficiency. We're all deficient at certain levels, and so where we're at, we can still be young. So again, but pain, when we have pain, that's not a problem, it's a signal. And the signal is, hey, there's something wrong. That's our body's response to saying, don't step on it. If it's something hot, get off of it. If it's something sticking in your foot, pull it out. But then that internal pain that we get to experience from different types of aches and pains, wear and tear on the body over the years, that's when we start to it's not just aging, it's, okay, something's wrong. Yeah, maybe it is high mileage on our bodies, but again, just like a car has high mileage, we can also get tune-ups, and to keep things moving. One of the things I believe in, the reason I became a doctor is I like to help people get better and put them in the best position to do that. And so, again, the goal is to avoid pills, potions, lotions, creams, surgery so that we can get you better. And again, and I practice all of it. They all have their places. So again, where we're at, like I said, I have my main practice, this regenerative medicine practice that we're starting is called Restorative Edge Clinic. And we'll talk more about, why PRP works and how it can help you. So I have and it's kind of blurry, but you can see this is just a kind of a skeletal presentation of the foot. And we've got ligaments, tendons, muscles, nerves, arteries, veins. There's a tremendous amount of structure in the foot that comes down through the leg. And if you think about what your foot does, what your ankle does, it has to work that quickly to help you take a step. And when things aren't hurting, you don't think about it, okay? So, I always like to point out the eyeball. Most of the time, does anybody's eyes hurt right now? No, your eyeball never hurts. It's not supposed to hurt. If it hurts, you go see the doctor. Again, your foot's not supposed to hurt. A knee is not supposed to hurt. A shoulder, a hip. So those are things that are showing that, there's things going on. But there's a lot of force and a lot of structure that goes through the foot and ankle and leg. And there's lots of things that can get hurt. So again, we have nerves. We have your Achilles tendon. We have multiple joints. We have muscles, tendon attachments, everything in there. And all those can get hurt if you're lucky. And I say that sarcastically. Again, same thing. I have this slide up here to talk about heel pain. Again, when we look at a heel, we have our plantar fascia, and that's what most people think is heel pain. But those little yellow lines are nerves. And more often than not, it's nerves that are the result of the pain that we experience in our foot and heel, even going up into the ankle. Again, an injured nerve can be treated with regenerative medicine, just like an injured fascia, an injured joint, muscle. So the goal is, let's get better. If we're having pain, there's different ways to get you there. So this is an example of a blood draw for PRP, okay? And so this is when we pull out the blood, we spin it, separate it. And so what we have here in the yellow, that's somebody's plasma. That might be mine, actually. Because I do it to myself. I practice what I preach. The red is just a small amount of red blood cells, which gives it that red tinge, but then it's all of the platelets, super concentrated. And that's when we combine the platelets and the plasma, that's part of that regenerative healing process that we're going to talk about. So again, in our blood, though, we have white blood cells, red blood cells, platelets. Those are the three cells. And we have our plasma, which carry all our growth factors, all these things that make us heal. And again, how the body was programmed to do that. So this is someone took an electron microscope and took an image of it. So they're labeled there. You have the red blood cell. Its job is to carry oxygen through the body. That's what keeps us alive. And so without a red blood cell, none of this other things, anything else we're talking about doesn't matter, because if you're not getting oxygen, nothing's getting better. The snowball there, that's a white blood cell, and there's different types of that. And you can see the size difference, but that little squiggly thing looks like an alien in the middle. That's a platelet. And the amount of power that's in that platelet is pretty astonishing, and how that platelet was designed to heal the body. And so we'll talk more about that as well. So again, platelets. They're small, they're colorless, they have no nucleus. If you go back to your high school science days, in a cell there's a nucleus. They don't have that. But they're just as a box. As soon as you open it up, it heals things. And they're designed to recognize injury, whether that's inside the body or outside the body. So again, they are good at accelerating healing, and whether it's in the muscle, whether it's a broken bone, whether it's a scratch on your skin. Okay. So again, plasma, that's that yellow concoction that was there. So again, plasma is made up primarily of water, and then it has all the different growth factors, these proteins. We like to call them growth factors. There's tons of them. But what the growth factors do is the platelets say to the growth factors, you do this, and the growth factors will do what they're supposed to do. And it's this concert that's combined, and the body is designed to heal that. And again, nothing that I do, nothing that you can do can make the platelets or your plasma, these growth factors work. They're programmed to do that. It's just if you can get it in the area at super high volume, your body heals. And it's pretty remarkable. So again, with this is, again, kind of what it looks like. So when we draw your blood, we're getting ready to pull it. And this layer right here, that's that concentrated layer of platelets. Everything else is the plasma that we also concentrate. But again, we put those two together and your healing just exponentiates. It's amazing what it does. Speaking from experience of what I see.
Sore spot?
Well, yeah, so there is injections. When we find, I can identify under an ultrasound right where it's at, where the injury's at. We do numb you up. So it's not always a pleasant experience, but you've already been hurting, so you're used to pain at this point. But and it's amazing what it will do within a 6 to 8 week period of the amount of healing that happens. So again, just a little bit of history, just quick. There's a lot of information out there. We started figuring out what platelets were and what they did and the growth factors back in the 1940s. And then they started doing some more experimentation. And really, in the 1980s, late 1980s, they started realizing, hey, if we can get some platelets on, and they started using an open heart surgery initially. They would take it, and again, they still do it. When I was in my residency and doing my anesthesia rotation, I was doing the anesthesia, they were doing open heart surgery, and they would take some PRP from the patient and spray it over the incision once they had closed it, because they just found there was a higher success rate in healing. Sternal incisions were notorious for not healing well, and their success rate went up by just using that. So they'd figured, hey, platelets help heal. And they started using maxillofacial surgery, and again, to help with healing and regeneration. And it's just blossomed since then as we've gotten more in tune and understanding more about what's in the plasma and what the platelets do. So again, as it up here, why am I here? Why am I a doctor? The goal is to help you heal and then also stay healed. A lot of these things we end up doing sometimes are just masking symptoms. That's what a steroid injection is good at doing. Steroid has its place. Again, if you have a pulled muscle and you take some ibuprofen, that's masking the pain. Is it addressing the issue? Not necessarily. Oftentimes our body will heal itself if we give it a chance to do that. But there are times where just the signals get crossed and we don't heal. And so now we are in this state of perpetual injury, and just the body has tried for so long, and it just says, I give up. I'm not going to do this anymore. Whether that's with arthritis, whether that's with a tendon or a muscle or ligament injury or a nerve injury. Okay. So again, the body can heal, and the goal is to help it do that naturally and effectively. So again, we talked about, and I call it the power of the platelet, and it truly is. So on this slide up here, we talk about, you think about if you get a scratch on your skin, enough that it's bleeding, next thing you know, you have a scab. A couple weeks later, 3 weeks later, depending on how quickly or slowly you heal, but that scab will fall off. And if it's not a deep enough of a scratch, you won't even be able to tell where that was. You'll forget about it. And you can think about it right now. How many times have you been scratched? I have a scratch on my finger right here. Is that, 3 weeks from now, I'm going to forget that was there. My body's healing that. The platelets are designed to heal. And again, the amazing ability of the human body, the creation that it is, and its ability to heal is pretty remarkable. But again, platelets are what make that happen. We talked about some of the growth factors that are there. So again, one of the things we try to do is with PRP, and this is how we get it. So we draw a small sample of blood, and that small sample looks really big to you. It's a pretty big syringe. It's 60 cc's or 60 mLs. So it's 4 tablespoons. So 4 tablespoons, 15 mLs is 1 tablespoon. So when it sounds like 4 tablespoons, it's not that much. But when it's your blood coming out, it looks like a lot, okay? So once we pull that blood out, then we're gonna put it in a centrifuge. And the centrifuge looks like this. This is actually I have one that looks just like that. And what this does is it spins at a super high rate for anywhere from, depending what we're doing, but usually it's about 10 minutes at 3,000 RPM. And that image we had a few images back of with the light and that little vial, that's what we end up, just using physics and gravity. The blood cells are heavier density than the platelets, and then our plasma has the least. And so by separating that layer, we're able to just pull it right out and then concentrate it. So again, this is what we're looking at, what we talked about. So you have that platelet-rich plasma layer, and then what we used to do is we would just draw this section right here, and that's what we would use. And this we would just throw away. And then we start figuring out, when we say we, like the medical community, smart people, hey, there's all these growth factors in there. What can we do to make that work even better? And so the technology's gotten good. We have these special filters that are good at pulling just the water molecule out and leaving the plasma there. And by keeping all these factors, now we concentrate them. Because again, if if you have a sore toe joint, I can't put 30 mLs in your toe joint. Number one, it won't hold it. Doesn't matter how much you numb me up, let's get it to a point where it's going to start squirting out. So, but if I can concentrate it down to 1 or 2 millimeters, get all that water out, and then I put that with the PRP in, it's even a better success rate. It's super, super concentrated, super potent. So again, conditions that are treated with PRP, you can use it. I do foot, ankle, and leg. You can do it anywhere on the body. We use it for hair restoration. We use it for shoulders, hips, spine, knee. Just about anywhere you can think of where you have a sore joint, you can put it in there. Is it always a fun experience putting it in there? That's a different story. But it does work. And so it works for a number of things. Like they're using, even on, like I said, facial regeneration, to get away those frown lines and worry lines, yeah. So again, this is me. I've had multiple knee surgeries, lots of sports injuries when I was young and thought I couldn't die. And you don't think about your ability to, what's the next day is going to look like when you hurt yourself. So this is, I have a torn meniscus in my left knee. It's been like that way for about 5 years. I haven't fixed it. I do this to myself because I still like to be active and exercise. So anywhere from every 6 months to a year, I'll do this to myself. I'll pull it out and inject myself. And again, I practice what I preach. It works, and it's kept me out of the OR, and I'm still able to do what I like to do. So that's the first part, is PRP. The next step we're going to talk about that makes, because anybody can do PRP, the combination is when we're using PRP and then shockwave therapy. So shockwave therapy is you're not getting shocked, it's not electrocution. It's using ultrasonic sound waves. And this is an example of a shockwave machine here. But we'll talk about what shockwave therapy can do. So shockwave therapy, and there's different units. Dr. Hunter uses the one here. This is one that works. I have a different brand. It works just like a Chevy can get you the same place as a Ford, right? It just depends on where we're going. So with shockwave therapy, in essence, I have a bunch of information up there. But think of has anybody had, even here, you guys have been tortured with probably the sore spot, and they like to rub on your sore spot, right? They like to get that really kind of get the blood flowing, right? So deep tissue massage doesn't feel super good, but it helps. It has its benefit. Shockwave therapy is like deep tissue massage at the cellular level. So one of the things when we have a chronic injury, we talked about the importance of blood and all the healing juices it has. What happens when a chronic injury is blood flow quits getting to that area. There's certain parts of the body where blood flow just doesn't get there anyway. And usually it's at these tendon injuries, whether it's on the rotator cuff, Achilles tendon, patellar tendon in the knee, any tendon in the foot and ankle really. There's not a lot of blood flow to begin with, just part of being human, and then you injure it. And then that chronic inflammation creates swelling, which actually lessens the amount of blood flow getting down there. And so one of the ways that we use shockwave therapy is kind of jump starts the healing. So we start to, by getting that deep tissue massage, we start to actually get these cells to start acting right. We kind of push the bad injured parts of a cell the waste products, again, a cell gets stagnant and it quits working. And so if we can stimulate it to start to heal, it starts that process. And so what shockwave therapy is good is that deep tissue massage, getting the blood flowing so that we can start to heal. So again, when we pair it with PRP, you have even a better success rate. The outcomes are far better. And again, I was speaking with the team doctor for Ohio State Buckeyes. This was probably a month ago, and he uses a similar machine, uses the same PRP system, and they do it on their athletes. And there are times where you'll just do shockwave therapy. There are times where they'll do PRP, but they almost always do PRP and shockwave together because it gets their athletes to heal more quickly when they have these chronic injuries that just aren't getting better. And so shockwave therapy is a great way to start that natural healing process that your body knows how to do. Sometimes it just needs to be reminded. So this next video is kind of cool. This is an example of the shockwave we have at our office, and again, theirs is similar. But what you're going to see here is this is the transducer. This little peak, this is actually in some water, and so this little peak is not there. This is just a flat piece, but you're going to actually see the sound wave, and we can send it to different depths depending on the amount of strength or energy we put into that shock. And so it's kind of cool when we see this go there. So you're going to hear some clicking. But that's just water, and we're not making so you can start to see it will slow it down, but that shock wave is going down quite a ways. So think of that on your body. So you'll hear some clicking. If you have an injured area, we can direct that penetration, that sound wave, where we want it to go, and get that whatever depth it's at, so that we can get you to start to heal. And again, just slowing down how fast or slow that each percussive wave, and just kind of really showing that. So a lot of times when you're sitting there and you're getting a shock wave done, you're like, is this really working? Other than it hurts. It is a little uncomfortable. Shockwave doesn't always feel great, but it's and almost always, anytime anybody has shockwave, they were hurting before they got there, and as soon as they put some weight on, they're like, wow, that doesn't hurt as much. And it might be like that for an hour, it might be like that for a day, but they almost always see a little bit of temporary relief. So when the goal is the difference, what we're trying to do different with Restorative Edge is we combine these two. When we do PRP, shockwave together, the healing and success rates are even higher. And that's anywhere on the body, whether that's down the leg, the foot, the ankle where I work, or where my colleagues work, whether it's anywhere, whether it's on a shoulder, a knee, a hip, a back, it works. So again, we're trying to accelerate the tissue repair. Your body knows how to do it, we just got to remind it. Again, with shockwave, or with PRP and shockwave too, the benefit is you can't overdose on shockwave therapy. You can't overdose on PRP. I mean, do we keep doing PRP over and over? No, we're just putting you back into you. So the risks are quite low. Again, obviously if you're not getting better, we're not going to keep doing the same thing. But the goal is that it's drug-free. There's no cortisone. There's no surgery. And we're putting you back into you to get you to heal and remind your body how to do that. So again, when you get a shockwave, anywhere from, how long are your sessions? Are they 10 to 20 minutes, about the same? Yeah. So again, it's 10 to 20 minutes. It is tolerable. It doesn't always feel amazing on the area, and it usually only hurts on the areas where you're sore, where the injury's at. We put the shockwave on any other part of your body. I mean, you might feel something on the focal. You don't feel anything. On yours, you'll just kind of feel more like a massage gun. But when we get to the area that's injured, that's where we know, and that's where we focus it. Again, it is tolerable. And again, speaking from experience, I'm not super tough. I can handle it. It brings a tear to my eye here or there, but no. But it does work. So anywhere from 5 to 6 sessions is kind of the starting point. Shockwave therapy doesn't work immediately. It's kind of an exponential. So you're just kind of creeping along for 4, 5, 6 weeks. You're like, I'm not sure this is helping. And all of a sudden, it takes off. I became a believer in shockwave. This was probably, let's see, it was my son's 8. So it's been 8 years. I had I injured a tendon on the side of my foot. I tried, the only thing I didn't try at the time was PRP because I didn't have a good system for it, but I tried some what people call stem cell therapy, some amniotic membrane. I tried rest, I tried therapy, I tried everything. And I'm a doctor, I kind of know what's going on, but I was like, gosh. And this, one of my colleagues said, hey, have you tried shockwave therapy? And I was like, I don't know if that sounds like it works. And so I did 3 sessions, and it didn't feel good, but I did it once a week for 2 weeks, and next thing about 6 weeks later, I remember waking up one morning. I was starting to feel a little bit better, and I just remember waking up and took a step and was like, my foot doesn't hurt. And it hasn't hurt since that time. Now again, I also addressed some of the things that led up to that injury by changing my orthotic and shoe wear a little bit. But so again, it does work. And so the technology is there to really help us heal. So again, when you have an injury, right now, most of the time, most doctors will say, okay, we can try physical therapy, we can try cortisone injections. If it's a joint, whether it's an ankle, I'll do ankle, knee, hip, we can try the gel injections, maybe a shoulder. And if that doesn't work, it's surgery. And again, surgery has its place. Sometimes, I see your beauty marks there in your knees. Sometimes, these things, we can't make it brand new, but we can definitely improve it. But again, if there's something that we can do to kick that can down the road and still allow you to have a good quality of life, not have the pain, it doesn't matter what your x-ray looks like or what your MRI looks like, it's what you feel. And so the goal is that we have, again, with PRP and shockwave, it's relatively non-invasive. I mean, yes, if I'm treating your Achilles tendon, I'm sticking a needle into your tendon. So that is invasive. But there's no scar, there's no stitches, there's no signs, risks of infection. There's nothing like that. Downtime is different, so again, knee surgery, knee replacements, that's a good time, isn't it?
Well, I was less, but yeah.
Yeah. Yeah. But I mean, how long did it take you to feel normal? A year?
That's my, because I got people that tell me, oh, 6 days I should be walking, right? And I said, no. And then they don't want to talk anymore about it. So
Yeah.
you got a year and then you'll.
Yeah. So, I mean,
You're trading one pain for a different.
yeah, you're robbing Peter to pay Paul that's the human body. So again, it can take months to heal from a surgery. And again, your body will do that. Like when I tell patients when there's surgeries I have to do, I'm not healing you. I'm putting your body in the best position to give it a chance to heal. And there are times where you have to do surgery. But there are even times when we'll do surgery and I'll still add PRP at the end because it accelerates that healing response. Just helps things heal. Like if someone ruptures their Achilles tendon, we have to sew it back together most of the time so that it can actually heal. But again, we're taking an area that's injured, that's lost its vascularity, and we're hoping that the body will do it. But when we can add PRP, the healing is even faster. And so just because we're hypercharging that body to heal and do its thing. Again, but surgery has its risks. Anybody who's had surgery, and I have a risk, a talk with any patient I'm doing surgery on, there's risks of infection, there's risks of wound healing, there's risks of need for more surgery, continued pain. You can die, you can have an amputation. Those last 2 things aren't as common, but that is a risk. I also say to patients, you can also get struck by lightning today on the way out, that's a risk. But the more common ones is you have the surgery and it just didn't quite work. Maybe it's a little better than it was before, and I've had that happen to me, with patients, and we try to do other things to get them better. So again, the risks of PRP and shockwave therapy are minimal. Outside of you just have to be patient. And I always tell patients, you've been dealing with this pain for a while. We're not going to, no matter what we do, whether it's surgery or anything else, we're not making the pain go away tomorrow. But if we can get your body on that right track to heal, it'll do its thing. It knows how to heal. Which, again, we just have to remind it. All right, so again, we talked about some of the candidates for this is for anything, whether it's shockwave therapy and PRP. Again, down on the foot and the ankle, again, any fascia, any muscle anywhere, it can work. So someone had a question earlier about bad candidates. Pregnancy is not one that we'll do. Same thing with shockwave therapy. Pregnancy, cancer is not one. if you have an active cancer, outside of, like if someone's getting treatment from the dermatologist for a skin cancer that's not melanoma, that's different. Are we going to do it in the area? If you have a skin cancer right by your knee or right by your ankle, we'll probably wait till that's gone before we tried something there. But in general, kind of the big cancers that we're going to stay away from that type of a treatment. Again, infection, if you're really, really sick, probably need to wait till your body gets better. It's not going to help with that. If you have any platelet issues, you got any problems with low platelets, high platelets, any type of something that you're seeing an oncologist for a chronic blood pathology, we're going to probably not do that. As far as PRP, shockwave, yes, that's a possibility. Again, for us youth deficient people in here, growth plates aren't an issue for us. Our growth plates have all closed a long time ago. But if you had kiddos, grandchildren that have an injury, shockwave therapy is not great for over growth plates. It can cause early closure of the growth plates. So we don't do it on that. PRP, yes. But again, most kids heal overnight, so we don't worry about those things. The last thing is this, you can be a diabetic and still get shockwave therapy or still have PRP. It's if you're uncontrolled and we got to get, doesn't matter what we do, if your diabetes is out of control, you're going to have a hard time healing. Because again, your body can heal, we got to get it in the right position to do that. All right, last one. So this is a patient of mine, and she's been a patient of mine. I've done surgeries on her, I've done other things. She was willing to be tortured by me with some PRP and then was willing to talk to us afterwards. So super nice lady. So let me see if I can get that to work, maybe. Nope, hold on, come on. Let's go back, there.
When a doctor tells you they do it to themselves, that makes you more confident. I've had double knee replacement, right hip replacement, 2 shoulders replaced. Well, the next step was getting this ankle replaced. I wish everybody would know about this PRP because it is a wonderful thing. It takes the pain out of it. You don't have to have surgery.
We didn't force her to say that. Like, there was nobody in the room. So, and we've done it a couple times to this young lady here. But over a several year period. Like the first time I did it was back in, I think, 2022, and we just did it again. So she's had good relief for that. And again, she's happy. Do her x-rays look great? They don't, but she doesn't hurt. And so, and that's the goal. So when we're dealing with chronic pain, again, the longer you wait, the harder it takes to heal. And that's just the nature of things. Doesn't mean it can't heal, but it can take longer. And so the goal is not, if you're hurting and you've tried a bunch of different things, again, that's your body. That's not youth leaving your body, as we joked about earlier. That's your body saying, hey, something's hurt. Let's get this better. Let's fix it. Let's get you to heal. So again, PRP and shockwave is highly effective at getting you to heal. And then we avoid surgery, reduce your pain. And then we also get you in with Dr. Hunter. As you guys all know, I always joke around with patients, the abbreviation for physical therapy is PT. This is preferred PT. Physical torture is also abbreviated PT. So he likes to torture people, and it's true. But again, I know, and you come back for more. So that's the goal. It's like you walk out, you're like, I paid for this, and so. But the goal is that we get you to heal because, again, my belief is not just treating the pain, but then treating the cause. Again, if all we do is just treat your pain, yeah, PRP can make it go away. But if we're not treating the cause, you're just walking in a big circle. And we're going to be right back to where you were eventually. Now, again, with certain arthritic conditions, if your knees, you might have to come back every couple of years or once a year. But if we're still keeping you active and doing that, then that's great. But if it's the tendon injuries, the muscle injuries, the gait issues, that's where physical therapy, changes in shoe wear, orthotic therapy, all those things make a difference. Okay, so Dr. Hunter and I, again, as we're talking about doing this, we do have an offer, and that's just for today for anybody who's here. And so the goal is we want to get you to heal. The question that was asked earlier, does insurance cover this? Insurance does not cover regenerative medicine. That's what we call shockwave therapy, PRP, It does not cover that. Insurance is not your friend. Insurance doesn't care whether you're sick or healthy. They want you to be just sick enough to want to have the insurance but not use it. It's pretty frustrating. Insurance has become your doctor. I will recommend something get done for a patient, and then I'm talking to the insurance company about why I have to justify. They're saying, no, they don't need that. I'm like, well, have you seen the patient? Nope. But our policy is we're not going to pay for this. They need to do this, this, and this. They need to have 3 steroid injections. They need to try X number of pills. They need to be in a boot for 2 or 3 months. And then maybe we'll say, hey, you can have an MRI. They will never approve PRP. But when we look at the overall cost of downtime, cost of a surgery, the physical therapy, the costs actually are much higher when you go down the surgical pathway than when you go down the regenerative medicine pathway. The goal is that we're providing effective one-on-one service. We're taking time. When you're coming to see us, it's not hey, I got about 6 minutes and I got to move on to the next patient. We're going to be there to make sure that you get healed. We're spending that time with you that you deserve, that you're paying for. And so the goal is to get you to heal. So when we combine all these treatments, it's 6 sessions of shockwave therapy, a PRP injection, and then 6 sessions of physical torture here at Preferred Physical Therapy. The price is what we had up there. But this is what you get for that. Let me go back. So that's the price up there, the $49.95, and I'll talk more about what that gets. Again, the goal is that we appreciate your time. We want to get you better and then reward you for being here and listening to me ramble on about PRP. So again, what you get with that is you're going to get it, again, I do foot, ankle, and leg. I have a colleague whose name is Dr. Alvord, who will do any other part of the body. And he's good at doing that as well. So whatever area we're working on, you're going to get the PRP injection. You're going to get 6 shockwave sessions here, as well as 6 physical therapy sessions here. You're also, for me, if it's a foot issue, we'll look at orthotic therapy. If it's somewhere else, we have a sleeve that's called a Reparal sleeve. And that's pretty cool technology that's come out in the last several years, where it actually takes your body heat and converts it into almost like infrared therapy that stimulates blood flow and stimulates healing. A lot of the professional athletes use it. They put it over at post-recovery, after a game, after a treatment. So it's a pretty cool technology. And so you also get that you get to wear that over the injured body part. And a lot of times you'll wear it at night. You can wear it during the day. They're comfortable. They don't hurt to wear. And then the goal is that we're going to make sure that you get better. Do most people get better with one PRP injection? Most do. There are times where we don't get you all the way better and it takes a second one. There are times where the PRP is not working. We actually go up to the next level, which is called cell therapy. And that's where we actually pull out your bone marrow. Or we can use it, harvest fat, which has a lot of, whether it comes from the leg or from the abdomen, has a tremendous amount of stem cell, and then we combine that with the PRP, and that's what we call cell therapy. So the goal is, if PRP doesn't always work, usually a second one almost always does, and if that doesn't work, then we're going to do, we'll talk about the next step for bone marrow. But the goal is that we're, to get you better so you don't have that pain and discomfort. All right. Okay. So again, I appreciate your time for listening. Now, questions.
Beside this treatment, do you prescribe or do you do other treatment, like a PT for physical therapy for foot? Like I went to neurologist, and he said that I have a neuropathy. I was wondering, the podiatrist that I went to 3 years ago prescribed a PT. That's when I came here after my knee surgery. So do you prescribe physical therapy for other than this?
Yes. Yeah, I'm a big fan of physical therapy. It definitely has its place to restore motion and get things moving.
So do you have a patients that asking you that have a problem with neuropathy that do you prescribe a physical therapy?
Yeah, there are, depending on what type of, like again, if we're talking about, yeah, no, well, I said if we're talking, yeah, if we're talking about, if it's peripheral neuropathy and it's, both feet or both hands, PRP doesn't always work on that. It can, but it's not as effective. Now, if you have like carpal tunnel syndrome, tarsal tunnel syndrome, you have a specific pinched nerve, whether it's in the back, it can work for that very well. I use that a lot the thing I deal with in the foot and ankle. I showed that picture we had earlier of the skeleton and all those little yellow lines of the nerves. I'll put PRP under ultrasound right around that nerve and the people will get better, so we avoid surgery in that instance. There are other treatments that I have that are not necessarily regenerative medicine, and we can talk after this more about that, but for peripheral neuropathy.
I know that the neurologist was telling me that there's not really a treatment for the neuropathy that he found, because I have the test that he did, the needle thing, and he said unless it gets really worse, then he will think of something other than right now just bear it.
Is it painful or is it just numb?
It's uncomfortable, because it's kind of numbing, and it's hard to explain because I still go to, I mean, I can still walk and do all of the activities that I mean, the only thing that I can't do now is hike, because I used to be a hike.
Yeah, you like to be active. Yeah.
Very active, but because of this, my maintenance is just going to the gym, riding the bike, and massaging it myself. And like I have TENS unit that sometimes I use. But what is the difference between the TENS unit and that one, the Shark?
Oh, completely different. Yeah, this is sound wave. TENS unit is electrical stimulation impulse. Yeah.
Machine that you have, the insurance, this is not approved. Okay.
Nope, insurance won't cover any of these treatments. Yeah. So again, shockwave therapy is good at mitigating those symptoms, like you said. Again, PRP can mitigate those symptoms. For how long? It really depends. And then there are some other things that we can also do that can help as well that sometimes insurance will cover, but we can talk about that afterwards. Any other questions?
Is there a place on the body where the doing the PRP is ineffective? Talking primarily shoulders.
No. I mean, shoulders work really well. Again, whether you have a torn labrum, again, I'm not a shoulder specialist, but I've had 4 shoulder surgeries on myself. Again, I did a bunch of rotator cuff repairs in residency, and with some of the colleagues that I know that do this, it is very beneficial. The other thing that works well too is that cell therapy, the bone marrow, is very beneficial at decreasing those symptoms of osteoarthritis for a year or more.
I had shockwave in both shoulders over a period of time. It's made a difference, but it's coming back.
Yeah. So sometimes, again, when you can under ultrasound, you can see the lesion in the rotator cuff, or if you got something that's your acromion. There's some different areas that you can actually make it. You can direct the PRP right in that area, and actually get it to heal even faster. Yeah. So that, I guess one of the things I can talk about, PRP, like I said, it doesn't heal overnight. The first several days can be uncomfortable to a week where you're wondering, what did you do? It can be, pretty achy. During that time, we have you stay away from any type of anti-inflammatory medications. You're doing ice as needed, but the goal is we're trying to create this inflammatory response and jumpstart your body to heal. And then over the next 6 to 12 weeks, we're actually at 2 to 12 weeks, that's where you get this remodeling. And there's different phases of remodeling and healing that occur. And that's where and that's kind of, again, what the platelets are telling your growth factors that tell your cells, okay, you got to do this, you got to do this, you got to do this. So no different than, if you had a fire in the kitchen. I always use this example. If you have a fire in the kitchen, you're going to put the fire out, and that's an extinguisher. So that's what steroid is. That's what cortisone is. Cortisone is the extinguisher. But then once you get done, you have this damage. The kitchen looks terrible. And now you got to call the repair, the remodeling crew to come in. And then do they fix it in a day? It usually takes several weeks at least. So again, the remodeling crew is the PRP and shockwave therapy. But the benefit of PRP is that it can actually put the fire out as well and then keep it out. All right, any other questions? I've seen a lot of nodding. Everybody everybody has aches and pains.
I have had 4 knee replacement surgeries over the last 4 years. And the last doctor I went to said that I have jumper's knee.
Okay.
And he thinks PRP would work.
Yeah.
Do you agree with that?
Yeah.
So I've tried shockwave with Alani over there about maybe 8 sessions. And it was better, but I mean, when I get up, I'm gonna when I walk out of here, but it gets better as the more I walk around.
Yeah, you warm it up and then it feels
Right.
better.
So 1 session, because my doctor told me that it definitely doesn't feel good. It's a pretty awful feeling.
So usually we try to numb you up first. So the numbing part's not fun, but then the goal is that we get you numb, so then you don't have to experience that. Yeah, because PRP, I've done PRP in my knee, not in a tendon, but I've done it without anesthesia, and it didn't feel super good for the first hour. But yeah, no, if you know how to numb up the area, like I said, my colleague Dr. Alver knows how to do that. He's an anesthesiologist, so he's good at putting needles in all sorts of places. Yeah, you can make that get better. Sometimes it might take 1 or 2. Again, and if that doesn't work, then you go to the next level, which is cell therapy, to get it better. But your body can heal. It has that ability to do so.
So why isn't the body healing itself without this additional support?
So why isn't the body healing itself without that support? That's a good question. So again, one of the things that happens, like I talked about a little bit earlier, when you have an area that's chronically injured and inflamed, your body tries to heal. Those signals are going, but then you just keep hurting it. So we'll use Achilles tendon, for example, because it's pretty hard to not walk, right? You can't get around in life and not walk. And so an Achilles tendon, that's that big tendon on the back of your ankle and heel. When that's hurt, your body sends inflammation, it gets sore, and we talked about the lack of blood flow to that area. But then you keep taking a step, so every step you're hurting it over and over and over and over. So you start doing that for a few days, and you do it for a few weeks, and then you do it for a month, and then 2 months, and pretty soon your body just says, you know what? I quit. I'm just going to forget about it and move on. And so that tendon now turns into degenerative tendon. So when I've done surgery on an Achilles tendon, I don't do a lot of Achilles tendon surgery anymore, actually, because I do PRP and I get people better. But those times where people are just like, they just don't want to do it, when I actually cut into that tendon, inside the tendon doesn't look like normal tendon anymore. It looks like someone's put a bunch of fat inside the tendon. And that's that degenerative tendon. And so it doesn't look healthy. And so by cutting it out, I'm now stimulating this new inflammatory response, and the body starts to heal. But that person now can't walk on that foot for a month at least. They're in a boot for 3 to 4 months. They start therapy at 4 to 6 weeks. At 6 to 9 months, they're like, okay, I think I'm happy that I had this surgery. And usually by a year, they're like, okay, I'm doing okay. But again, what happens is the body just kind of says, I quit. I'm not going to heal. And so again, the beauty of PRP, number one, just by sticking that needle in that sore spot, we're creating the injury, but then we, really ramp it up and your body heals. The signals are there. All the receptors to heal are there. They've just been dormant because the signals haven't been getting there. And so we try to get it there so that you can heal. Does that make sense? Okay. Any other questions? I know everybody's tired of sitting. These chairs are super comfortable, huh? Yeah. So again, like I said, we'd love to help you. The goal is to get you on your feet, keep you active, so you're not coming in. I mean, I know everybody here loves to see you, but they'd rather you be better and move on. That's our goal. That's why we do this thing, is actually help you heal and keep you healed. So, all right. All right. Okay. Appreciate your time. Thank you, everybody.